Hi, I'm Warren Fish from County Commissioner Jeff Cogen's office, and I am here today with Tricia Tillman, Program Manager for Multnomah County's Health Equity Initiative. And we're going to talk about that Health Equity Initiative and some of the health disparities you guys are aiming to get the word out about. So I understand that there are vast differences in health outcomes in our community looking at different populations. Can you give us some examples that really stick out from the data?
Sure, and thanks for the opportunity to be here. So in terms of health disparities, we know that they exist by race and by class, and they exist across the whole life cycle. In terms of chronic diseases, which is a big concern for adults and increasingly for children, there are disparities by race. So for example, heart attack, 4% of whites in the state of Oregon and similarly in Multnomah County experience heart attack, but the rate is 2 times that, or 8% for African Americans, and even bigger than that, 10% for Native Americans.
Wow.
For diabetes, it's also big disparities. So 6% for white, 13% African American, 12% Native American, 10% in the Latino community.
And what are some of the causes that you guys have identified, or what is some of the work that the Health Equity Initiative is doing to try to raise awareness, I guess? Well, you tell me about it.
Okay. So first of all, what we want to do is really raise awareness of what are the upstream causes, because for most of our conversations that we have in the public around health issues, we talk about health care. But we know that if everybody had access to health care and got the best quality of health care, that doesn't stop people in our community from actually getting diabetes or having heart attacks. It just gives them care after the fact. So we're looking upstream at some of the causes, and some of those include access to healthy and nutritious food, which we know there's different access depending on what kind of money you can spend on your groceries. We know that some of the causes are around chronic stress. So the experience of some cultures of institutional racism is significant. For others, it's being uprooted and displaced from their traditional culture, their traditional foods, the way that their families are structured. Those things all impact on stress, and stress impacts on the body's ability to stay healthy.
So is what you're finding in the research and in the data from our community that people living in poverty and people who are affected by institutional racism are actually dying and getting chronic diseases at much higher rates?
Yes. I mean, that's what we're saying is the things that we need to be looking at as a public health department and as a local county government.
I think so too, yeah. How did you first get involved in this type of work?
I started my work in public health, 18 or so years ago, and my focus has always been on community building, community engagement. I worked in a community health center that was started in Tucson, Arizona by the Latino population, Mexican Americans, and so I've always had that focus on disparities in health care. Since I've been at the health department, I've had the opportunity to really help the department shift its focus to looking at health disparities, building that into our strategic plan, and then making sure that we have ongoing community involvement in the decisions we make as a department.
And speaking of community involvement, how can folks from Jeff's district, District 2, become involved in this effort?
So what we're doing this Saturday, several Saturdays actually throughout the months of September and October, we are bringing back to the community policy ideas and suggestions that we heard when we were screening a documentary called Unnatural Causes, Is Inequality Making Us Sick? And so we have a long list of policy ideas, and we're just bringing those ideas back to inform the community about different options, and we're asking people to help us prioritize which policy solutions we move forward on. The next one that's in Commissioner Cogen's district is on October 11th from 1 to 3 p.m. and it's at PCC at the Cascade campus. And people can check out our website if they want more information.
Well, thanks for joining us today, Tricia. We really appreciate that and this work that you're doing. And if folks want to check out more information about the Health Equity Initiative, there's a link to all the project's work and the unnatural causes video that you mentioned on our website and on the Multnomah County main page. Thanks.
Thank you.